I am Dr. Elena Klimenko, internist and integrative functional medicine physician in New York City, as well as in Florida. I see patients in both states. And today we're going to dedicate some time learning about high uric acid, doing more harm than good. We're going to talk about what it is and where it's coming from. And thank you very much for joining. Over 66 million people in the United States have high uric acid. So it's not something that is incidental or rare. We see it all the time. And the high uric acid can contribute to development of other chronic illnesses like hypertension, obesity, diabetes, chronic disease, and non-alcoholic fatty liver. And sometimes high uric acid happens before, we can detect it before, way before those chronic illnesses start occurring in our patients. So it's a good predictor of where the patient's going to in their metabolic health, if their uric acid is normal or if it's elevated. And that's why we need to pay attention. And if you just going to a conventional doctors, please ask for the uric acid test. So today we're going to talk about where is this uric acid come from, what happens to our body when uric acid is too high, and how do we know if uric acid level is high? Is it if it's high, or is it optimal, or is it normal? Those are all different meanings. How can we lower the uric acid level? And then we're going to talk about announcement in my practice. So uric acid, where is it coming from? It comes from foods and drinks that we consume most commonly. So foods and drinks are high in purines, or foods and drinks that are high in the fructose. So as you can see in this little table on the right side, there's foods that are listed from high to low, high purine foods, and then high fructose food and drink. So as you probably know, that organ meats, things like liver, kidney, or sweetbreads, which is pancreas, a variety of the meats, especially red meat. Some fish are higher in purines than other. For example, anchovies and sardines, halibut and tuna are higher in purines. Shellfish, like crabs and fish, shrimps, and interestingly, brewery yeast and some of the alcoholic beverages, specifically beer, is very high in purines. And some even plants are high in purines, like spinach, lentils, beans, and asparagus. But also pay attention to high fructose foods and drinks, because fructose can convert to uric acid. And we actually see how dietary changes can affect people's uric acid level. Please pay attention that soda is one of the highest foods and drinks that are so overwhelmingly high in the high corn fructose syrup that people who have a problem with uric acid should probably not even look at soda. But also fresh juices from the fruit, not from the vegetables, but from the fruit, are really high in the fructose. And remember, fructose can convert to the uric acid. Candies, sugary stuff, ice cream, popsicles, ultra processed food like packaged food and cookies and cupcakes and pastries, basically everything that has a lot of sugar, but also sauces and dressings, the hidden sources of sugar that we don't even suspect, and jams and jellies. So remember, it's not just meats, but it's also high fructose food that are responsible for elevated level of uric acid. So what happened to the body when uric acid levels are too high? When the levels are too high, uric acid is capable to crystallize. And those little crystals are deposited in our joints. So in most severe cases, the high uric acid levels can create gout. And the classical symptoms of gout is, of course, the pain in the toe. As you can see on this diagram on the left, that you can see that the toe, I don't know why it's not showing, The toe is one of those spots that is mostly affected by uric acid crystals deposits. And it occurs most frequently in these locations that are outlined in red. Okay, so toe, ankles, your foot. A lot of people have plantar fasciitis, inflammation of their foot, the sole of the foot, but it could be deposits of the uric acid crystals, but also knees, elbows, and other areas and locations that outline on this diagram in gray are less common. Things like wrists or shoulders, but they still can occur. So the symptoms of their gout is, of course, severe pain. Imagine you have this very sharp crystals. They look almost like a broken glass, and they are sitting in your joints. And every time you move, those pointy, sharp crystals piercing your tissues and create a lot of discomfort. That creates, of course, inflammation that corresponds with swelling, red joints, red, hot, inflamed joints, and difficulty of movement. So this is a really classical presentation of gout. But also the other consequences of uric acid elevation could be elevation of blood sugar or insulin resistance, things like general inflammation in the body, even weight gain, progressive heart weight gain. But if uric acid is long lasting, it can contribute to their coronary artery disease, fatty liver disease, and ultimately even memory problems. So many chronic illnesses can correspond with this one metabolic marker. So that's why it's so important for us to test it. But when we go to the regular doctors and they test your level, they will look at the range. And the range is basically 2 standard deviation from the medium or middle of their 100 people from the street, right? So this 100 people, relatively healthy, could have a very high level of uric acid, but they don't really express any symptoms yet. So they consider it to be healthy. But in functional medicine, we're really not looking at just normal range. We would like to look at the optimal range. And the optimal range for male would be below 5 milligram per deciliter, and for female below 4 milligram per deciliter. If the level goes between 5 and 6 for male and 4 and 5 for female, it's already borderline high. However, if you look at their reference range for the laboratories, you still will be within normal range. So when you read your labs, please pay attention, where's your numbers like? Are you in the optimal range or you in the borderline or even high? I've seen recently some of the labs report normal level 6.5, even 7, even 8. So it's definitely not normal, but because laboratory references are looking at those 100 healthy individuals from the streets, relatively healthy, those numbers could be very much skewed. So keep it in mind. Next time you want to review your labs or bring it to your functional medicine doctor. So how can we lower the high uric acid? Diet plays a huge role. And first of all, we really need to reduce the production of uric acid by avoiding foods that are converted to it. As we mentioned, the purines and the fructose. And our modern standard American diet, what we call SAD diets, SAD, standard American diet, is filled with the fructose and the hidden sources. Sometimes it's pretty obvious, like in the soda, but sometimes it's hidden. And purines too. We saw that that slide with their amount of purines in the different foods. So stay away from those. Minimize foods moderate in purines and fructose. So either avoiding or minimizing it. Minimizing sugars at any cost. And most importantly, also is to drink a lot of water, because uric acid will be excreted from your body through your kidney in the urine. So if you don't consume enough fluids, enough water, not soda, but water, you cannot excrete uric acid. So it's extremely important to consume sufficient amount of water. How much water to take? Usually it's a half of your body weight in ounces. When you have a high uric acid, you might even increase that range, but trust me, this is a lot of water. So if you drink half of your body weight in ounces, that's usually probably a good benchmark. I always recommend for my patients to consume half of that amount before 12 o'clock in the afternoon, and the other half from between 12 o'clock and 6 or to 7 p.m. So you consume all your amount of fluids during the daytime and not at nighttime, because then you have to wake up in the middle of the night and go to the bathroom, and nobody likes that. So try to consume all your water from the morning until early afternoon or late afternoon or early evening. And minimizing alcohol, especially beer, would help to reduce the uric acid level if it's elevated. And I love this plate. Oh, beautiful plate of vegetables. Okay, so we also, in our functional medicine approach, we have several nutrients that can facilitate the process of elimination of uric acid from your body. Vitamin C, of course, it has so many different applications, but in the dose of 500 to 1,000 milligrams per day, it enhances uric acid excretion from the kidney. It's a beautiful antioxidant and anti-inflammatory activity nutrient. So if there is an inflammation in the joint, it will help to calm it down. And it's also a cofactor for collagen synthesis to repair the tissue that was damaged by those sharp crystals. Remember, you want to take vitamin C in the small doses. You want to take it 500 milligrams every few hours or twice or 3 times a day as needed, because our gut absorption capacity at one given time cannot handle more than 500 milligrams per day. So whatever you take more is probably just going to be wasted, unless you're taking liposomal vitamin C. Quercetin is another very important nutrient. It strongly inhibits uric acid production. It's an antioxidant and anti-inflammatory nutrient, again, and it even can lower your cholesterol levels. Luteolin from 100 to 200 milligrams per day also inhibits uric acid production. It's a brain protective nutrient, as well as anti-inflammatory and antioxidant. Interestingly, tart cherry powder inhibits uric acid production as well. It's also a strong antioxidant and anti-inflammatory medication. Berberine, beautiful berberine herb that has so many different applications in our body. It helps with their weight loss. It helps the insulin resistance. It reduces cholesterol in our blood, but it also has a beautiful antimicrobial qualities and helps us to balance people's guts. Fish oil as an anti-inflammatory nutrient improves cholesterol, brain protection, anti-inflammatory, and all of that in the dose of 1 gram to 2 grams a day. So I would like to present this case of my patient, Peter, who came to initial presentation. He's a 46-year-old man who presents for the wellness screening. His family history is significant of obesity, high cholesterol, high blood pressure, and history of heart attacks at early age. Family history of heart attacks, not his personal, not yet. He works as an office worker, so he's mostly sedentary. He sits most of his day at the computer. And as we know, sitting is the new smoking, right? So it's a risk factor now. And his diet is filled with the fast foods, snacking, and lots of soda. He drinks 2 to 4 12-ounce can of soda every single day. He likes it. He's addicted to that. It gives him spurs of energy when he is feeling tired. And he reports a moderate level of stress, and his activity level only 20 minutes per day. He walks his dog. Well, it's good. It's a good start. When we examine him, we see that his measurements are all pointing to metabolic syndrome. He's 5'10", he's overweight, his BMI is 31.6. But remember, BMI is not always indicative of their metabolic health. Some bodybuilders who have a lot of muscles and they have a huge weight could have a high BMI. That's why in our practice, we don't just look at BMI. We're looking at the body percentage of body fat. Anything above 25% is trending towards obesity. In Peter's case, his body fat was 35%. His blood pressure was borderline, elevated, 146 over 92. And when we checked his blood test, his uric acid was high. So high 7.2, his cholesterol was elevated, his bad cholesterol was elevated, his HDL was unfortunately low. HDL, as you know, is a good cholesterol, and his triglycerides are high. Here's the tip. If you see that your triglycerides are high, it means that you're eating way too much sugars. And except for some of the genetic predisposition or disorders, triglycerides, fasting triglycerides that are above 100 is an indication that your consumption of sugar is a little too high. And look at his hemoglobin A1C, the marker that shows us their status of the sugar level for the last 3 months is also elevated. It's not in a diabetic state, but it's definitely in pre-diabetes range. So what did we do for Peter? From our functional medicine approach, we first of all prescribe diet and lifestyle changes. That's the biggest impact you can make in your health. So we ask him to swap his soda for sparkling water. I know it's not the perfect replacement, but that's a really good step towards healthier choices. And he did that. We started teaching him how to do the meal prepping to minimize the fast food convenience. Also, we taught him that he can prepare his meals not only for lunch, but also for dinner. So he has less tendency to order food when he comes back from work and tired and can't make it. He already has prepared meals or partially prepared meals. We ask him to change to more healthier snacks. Things like seaweed. People who like the crunchy chips, seaweed can be a nice alternative. They're crunchy, they're salty, but they have much more nutrients and they don't carry a lot of bad stuff with them. We ask him to maybe pack a couple of vegetables with hummus, things like celery sticks or raw broccoli or raw cauliflower with hummus. That's nice and savory. And we told him that dark chocolate in a small quantity, anything above 85, higher is better, 85% of chocolate could be consumed on a daily basis, at least not more than 1 ounce of it. We ask him to keep 2 vegetarian days per week. And that's a common practice for some of the people. So 2 vegetarian days per week will decrease his consumption of meat that is, remember, very high in purines, and will give a break for his kidney to excrete that uric acid. We ask him to double his movement and activities and ask him to double it to twice a day for 20 minutes sessions. And we recommended an app for meditation and guidance to decrease his stress. So meditation guidance, or just we can teach our patients also to just do their deep breathing and how to distress yourself in their given situation, or at the end of the day or in the beginning of the day. So any meditation you can practice is good for you. We also gave him some targeted supplements because his uric acid was so high. We gave him uric acid lowering blend, 3 capsules per day. We also gave him bergamot to control his elevated cholesterol level, and of course fish oil as an anti-inflammatory, cholesterol modifying nutrient, and to protect his brain and arteries and the heart. And of course magnesium. Magnesium is so important, and so many people are depleted in magnesium in our modern and stressful lifestyle. So this is actually a product that I really like for their uric acid reduction. It's called UAX Pro. It's a really powerful formula to minimize uric acid. It supports, it actually reduces their secretion and synthesis of uric acid. It promotes urinary excretion of uric acid and helps with their liver enzymes. And because of all these beautiful nutrients that we already discussed, vitamin C, quercetin, some of the polyphenols, tart cherry, celery seed extract, and luteolin. So all of those things will help people to drop the uric acid to a normal level along with their lifestyle modification. So in 3 months, Peter came back and he reports decent compliance with the supplements and lifestyle. He occasionally cheats with fast food, but that's okay. I tell my patients if they are doing great and according to our prescription, to 90% of the time, 10% they can cheat. But longer you live with a healthier lifestyle, you actually need less and less of those cheat days. He reports that he likes the sparkling water, and voluntarily he actually increased his physical activity to walking instead of 40 minutes per day up to an hour. So he dropped 12 pounds, his blood pressure normalized, and his blood work abnormalities started to improve. It does take time for uric acid to decrease slowly. So this is how we manage high uric acid. So because uric acid is such a vital biomarker for progression of the cardiovascular health, we put this presentation under our cardiometabolic vital program that we take our patient through when they come with their either cardiometabolic issues or with the elevated uric acid. We do the initial intake that takes about 90 minutes to meet, to understand your personal history, and to do the nutritional exam that we do for every patient, do our testing in the office, as well as we ordering some testing from different laboratories, functional medicine laboratories, as well as advanced metabolic testing with a variety of the labs, as well as conventional labs. We do go to send patients to conventional lab to check their CBC, liver function, thyroid function, even cholesterol, but we usually order advanced panel for cholesterol testing. We, during this cardiometabolic vital program, we also recommend a meal plan and lifestyle, as well as supplements that are targeted supplements. That's our intervention. Every patient in our practice will have an appointed health coach who will meet with the patients on a regular basis after the initial visit. And we will provide you some homework to do because your education is so important for compliance and for success achieving your health goals. And then you will have a follow-up appointment when we discuss the tests, see what works, what doesn't work. If we need to modify our program, we'll do so. And that concludes our cardiometabolic vital program. So you also, because you're attending today's lecture, have an opportunity to get this uric acid breaker bundle that will support uric acid level with targeted botanicals, enzymes, and natural anti-inflammatories to reduce the buildup of the uric acid, help your joints, and restore metabolic harmony. This bundle will include vitamin C, vitamin Bs, as well as the omega-3 fatty acid that is super omega because its absorption is 3 times higher than the regular omega-3 that you can buy from other brands. You can easily shop for these products at our e-store. You can find that e-store on my website, drelenaklimenko.com, and use this code URIC15 if you want to get a discount for this bundle. And what is the next step? I would invite you to take this wellness questionnaire by scanning this QR code. Send us your replies. If you're an existing patient, I will discuss with you at our next visit. But if you're new, we will incorporate in your initial visit discussion. You can also sign up for the discovery call with my staff. They will walk you through all different options, how you can become a patient, how you can benefit, which program you can benefit from. If you like us, follow us on the social media, and follow us on Facebook and Instagram. Subscribe to our YouTube channel where you can see a variety of the lectures that I give, and also sign up for our newsletter. Feel free to schedule the discovery call by calling our number that is here on the screen, or you can scan this QR code and request a consultation with my supportive staff.